Next on Health Tech Today, it's a new kind of telemedicine, seamless, dependable communication, enhanced by a suite of tools designed to improve patient outcomes while saving money.
They can have a high level of interaction from their home, they could do it from the office, they could do it from the hospital.
We take a look at a more user-friendly approach to telehealth.
When point A can draw closer to B, when here and there can become blurred, when communication can become actual conversation, you won't believe what can be accomplished, because there's nothing like a good chat to get stuff done. Polycom, the art of conversation.
Telemedicine is becoming increasingly popular, but this tech solution for more accessible healthcare needs to be scalable, mobile, and above all, dependable. Polycom is a leader in telepresence, video, and voice solutions. Building on Microsoft's unified communications, Polycom has designed a fully integrated end-to-end solution that can help improve patient care while reducing costs. Walking us through all this and a very cool demonstration is Polycom's Director of Global Healthcare Markets, Ron Emerson. Ron, welcome to Health Tech Today.
Thank you. It's good to be here.
So we've got this full-blown teleconferencing, telemedicine thing going on here with Dr. Jeffries on the East Coast. Tell me what we're seeing.
Yes, we're actually seeing a demonstration of a live telemedicine session, which we're going to show now. Dr. Jeffries?
Yes, Ron, it's good to see you today. Well, I'm going to start out by taking a look at the patient's face and eyes. So first of all, let me switch to that camera. You can see we're going to be able to do a close-up of that eye, but also I'm able to go back then and look at both eyes to compare symmetry. After I look at the patient's eyes, I'm going to also want to take a look at their ear in case there's something going on with the tympanic membrane. In this case, I'll use an otoscope. So I'm going to start going in from the outside, get a look at the external ear canal, and then basically work my way in to get a look at the tympanic membrane. You'll notice the different landmarks that you would expect to find. And then as we come back out, I can again do another examination to make sure that that external ear canal isn't having problems with fundus or swimmer's ear or problems like that. Not only can I use these two devices to get a good look at my patient, but I can also use a stethoscope, ultrasound, nasopharyngoscope if I want to actually get up and really look in detail. So Ron, I hope this gives you a good impression of the many devices that you can attach so you can do a good examination at a distance.
Okay, thank you, Dr. Jeffries.
Well, I think what's really cool about this, and I want people to understand, is working with Microsoft. What you've done is we've married Microsoft Unified Communications, Microsoft Lync, to your technologies that really are the last mile of telepresence and telemedicine. And this is making it more accessible to customers around the world.
No, exactly. And what we find, of course, is that healthcare organizations and professionals want one user interface. Microsoft Office Communicator provides that, but it also provides them the ability to escalate the level of communication. So this telemedicine session that we were in, of course, could have been just as easily a medical education session where we have multiple parties involved. We could have been using a live meeting, a bunch of different things. It could have been an administrative meeting. And what we can do is we can simply go from instant messaging, we could escalate that to a voice call, and then we could, of course, escalate that into a high-end video conference call like we just previously were in.
And basically, I mean, marrying this to Office Communicator or even live meeting, pretty soon you're doing desktop sharing and anything that you really need to do to communicate and collaborate over distance with colleagues for telemedicine, telepresence, even medical education.
No, exactly, which is key, right? It's the content and the data for education, and it's also, in the clinical perspective, you know, having access to real-time clinical data for clinical decision-making, electronic health records, PACS imaging, all those things reside on the desktop, and of course that's where Office Communication Server resides.
And of course telemedicine has been around since the 1960s, nothing new about telemedicine, but what is new is the fact that it is commoditized, it's available on the PC, it's webcams, I mean it's really much more available to more people at lower cost.
Exactly, and we have a dynamic workforce in healthcare. You know, a clinician, an educator, an administrator, They can provide and have a high level of interaction from their home. They could do it from the office. They could do it from the hospital. And of course, that's what this enables.
And of course, an important part of healthcare reform is opening up to more patients and more scenarios and more ways to deliver healthcare services while lowering costs. And that's just so important.
Well, exactly. And that's, when you look at unified collaboration in general, the whole concept is that it's more efficient to move information than it is to move people, and to be able to, decide what's appropriate for that interaction. And with Microsoft and Polycom together, what we've developed here is we can really escalate that to very simple, fast communication up to very complex, more involved communication.
So if our viewers want to know more about how to do this?
Yes, simply Polycom representatives and of course Microsoft representatives around the world understand this and understand the integration between the two companies, and just simply notify them.
Great. Dr. Jeffries, great job. Ron Emerson from Polycom, thanks for joining us on Health Tech Today.
Thank you, Dr. Krantz.
Learn more about Microsoft Lync, the next generation of communication server. Microsoft's Health Tech Today has been brought to you in part by Polycom. Increase productivity while reducing costs using Polycom solutions that quickly deliver results.
On behalf of Microsoft Worldwide Health, our staff and our sponsors, I'd like to thank you for joining us. We always enjoy hearing your feedback. And we'll see you next time for another episode of Health Tech Today.
For more thoughts, comments, news and reflections on healthcare IT, join Dr. Bill Krantz on Health Blog.